In your opinion, what are some of the more common challenges that you're seeing as a cardiologist that's impacting either diagnosing patients or treating cardiac patients?
It's a good question, Dr. Pete. I think some of the things that make it challenging are not new. Patient access, anybody that works in any health system has probably heard this term over and over. Sometimes we give it a new name, but it's the same problem. Trying to get patients in a timely fashion, to be seen, to get diagnostic procedures done, to get referrals to specialists. I think what can sometimes make it challenging is a shortage of providers, which seems to be, which seems to be worsening or could be worsening with a lot of our providers retiring in the near future. I think some other things, just strain on the health system in terms of financials. There's some decreasing reimbursement for certain procedures and certain types of care. And then also trying to be able to prioritize those that need care immediately versus those that can wait a little bit longer. And, in a push to make care more accessible to patients, I think many health systems have tried to make components of their care a little bit consumer facing. You just go on a website, you click here to schedule. But what that can sometimes do is clog the system up and make it hard to differentiate patients that need to be seen emergently versus those that can have some time to wait a little bit. And, to be fair to everyone here, sometimes you don't even know that until you've seen the patient. And so it's really challenging sometimes to balance this kind of demand versus supply on both sides of healthcare.
That is a great point you mentioned. It is something that a variety of health systems are dealing with, is trying to come up with a way to improve access. But like you mentioned, just because the person, they say that the squeaky wheel always gets the oil, but sometimes the squeaky wheel isn't the sickest and most priority patient that needs to be seen.
Yeah. But sometimes you got to see the mechanic for them to be able to tell you that, right? You don't know as the wheel whether you're dying or not. And so that's really the challenging part.
As a follow-up, I was just thinking, what percent of cardiologists are of African descent?
I wish I had a solid fact-based kind of number in the background of my head. I'll definitely say it's probably single digits. And then if you start talking about Black males or Black females, definitely low single digits. But certainly in the minority.
Does that impact a person's care if they're a person of color, if they have a Black cardiologist or not?
That's an interesting question. I think yes, right? Definitely yes, but not in all the ways you think it might. I think certainly there is an opportunity for some shared experience and bonding in a way that you might not otherwise. And that kind of bonding and shared experience, one of my favorite things about the practice of medicine is the artistic and kind of relationship building part. And I think that actually goes a long way. So I think that can really be a really positive experience for patients. But I think an important thing to note is that depending on your medical history and what you need done, you just can't get comprehensive multi-specialty care from an entirely Black or African American or African descent team. And so I think sometimes having one or a couple providers in your kind of broad care team that you feel like you can identify more closely with is super helpful. And then that person serving as a touch point or maybe serving as somebody who can help you debrief on other situations or if you need a little bit more guidance. But I think there's definitely some pros to having access to cardiologists that look like you.
Yeah, I totally agree with you, and I have seen in my own practice where patients will tell me that they either are so glad that they have me as their provider, and so I just try to make sure that we're improving access and things like that.
Let me pause for a second because I just want to hit on something you said that I want to echo, which is, that feeling when a Black patient walks into your clinic and you kind of see the smile on their face. I just want to express that the feeling is definitely mutual, right? I think there's definitely something special about just feeling like that patient is more seen, or feels like they can tell you things that they might not otherwise. So that's definitely a very special part of my practice as well. And I know some of my patients seek that out. So I think it is an important piece.
If you had any other thoughts about health equity, resources you use, or how do you improve or reduce health disparities in African American or patients of color patients?
Now, with regards to health equity, we spoke earlier about demand versus supply, and the supply part potentially worsening in our nation's future, just with a lot of clinicians headed for retirement and maybe inadequate replacement coming through the pipeline. With regards to health equity, my philosophy is that what's most important for patients, especially the generalized patient who maybe doesn't have any specific advanced diseases, is to establish care with somebody whom they can form a good relationship with. And nobody's going to tick all the boxes, right? And so maybe the box that they don't, maybe they don't tick the, hey, I can identify in the same minority group with this provider. That might not be it. Maybe the boxes that are important to tick is, hey, I don't have to drive 2-3 hours to them because I live in a rural area. Maybe I need flexible hours because of my work. Maybe I'm a veteran and, I got a VA that's close by. But I think once you get that, that relationship established, the other things that are important to think about in terms of health equity is, does that provider that you have a good relationship with, do they have access, or are they connected to a higher level of care if that's something you might need in the future? Do they feel like they are able to recognize or at least ask for help if you need a higher level of care? Higher level, could be anything like a minor surgery to something as advanced as a transplant or some heart assist device like an LVAD, right? So I think just having somebody that you can establish a relationship with, you can see on a regular basis, they know you. And then the final piece, when it comes to some of these advanced therapies, I've learned in my practice that 80% of people, they need general care, and general care doesn't have to be too sophisticated because they're not that sick. But for that minority that needs something really advanced, there's a whole lot of advocacy involved. Advocacy on behalf of the patient coming from their provider. And so is that provider somebody that knows you well enough that's going to kind of go to bat, be willing to call a surgeon or a transplant team after hours, attend some sort of multidisciplinary conference and speak to your willingness to adhere, or certain nuances about your history that might not come through in the medical chart. So I think having access to somebody that checks most of those boxes, or at least the important ones, is really important in terms of ensuring healthcare is delivered equitably.